Each year, 2.1 million women are impacted by breast cancer globally. This figure will continue to rise if we do not do anything about it. This figure will continue to rise if we do not educate, screen, and get women to get treatment in the early stages of breast cancer. The most significant risk factor for getting breast cancer is the fact that you're a woman and the fact that you're growing older. Researchers have gone on to say that even as there are people who have risk factors do not get breast cancer, other women who do not have risk factors get breast cancer. What intricacies occur? What goes into all of this? And then there are other environmental and hormonal factors that influence your chances of getting breast cancer. On the other hand, there are instances where we advocate for breast self-examination. I mean, check your breast every month. But then what happens if you are self-examining your breast and then you feel a bit of lump or something in the breast? You might be thinking it's breast cancer. It's not always breast cancer. Sometimes you have fibrocystic breast tissue. That is why you need to check every year. And on the reason why you have to check every year, you know, last year I came here to cover this program and I came here without a nose mask. This year, I have to come with a nose mask. That should tell you that a lot has changed. A lot has changed in your body. A lot has changed in your breast. Get tested, get screened, and know your breast cancer status. Join me, Bridget Amadente. Let's go in, let's learn, let's get screened, and let's know our breast cancer status.
Welcome to the Breast Cancer Awareness Month for 2020. And I'm from Sonotech Medical and Diagnostic Center. I'm here with my team of doctors and nurses. And as usual, we do this every year. I mean, we go out, educate people about the awareness of breast cancer, the need why people need to get screened, and offer free clinical breast screening for everyone who is interested. And then we also have the imaging services that Sonotech has. They usually would discount. For the ultrasound we have the 50% and the mammogram we have the 20%. So I'll just run through. This year the theme is for the breast cancer awareness is detect it, treat it, and defeat it. And Sonotech, we're also running with the global team. That is the global team. So we at Sonotech, we're also with that team. So I'll just run through what I'm sure you already know what we've heard about breast cancer. Some people may have had relatives or know somebody who's had breast cancer or who's been diagnosed or who's died or who's been treated. There's a whole gist about it. I'm sure we all know about it. So I'll just run through what we need to know about breast cancer. So statistically, I think for the past 5 years, there's been an increase in the number of people who have been diagnosed with breast cancer. And sadly, there's also been an increase in the number of deaths from breast cancer. I mean, the last statistics we did show that about 2,000 Ghanaian women die every year from breast cancer, which is very sad. Because if you compare that mortality rate with that of COVID, which gave everybody the whole world a scare, is higher than COVID. And the reason for this is because about over 80% of the women who present to the hospital come in the late stages. Most of them have gone to churches, gone to prayer centers, herbal centers, and all whatnot. And then when it gets to the advanced stage, then they present to the hospital. And at this point in time, we really cannot do anything about it. So that's why we go all out to educate people. It's not an automatic death sentence. Only if it is detected early, it can be treated. We have people who have been treated from breast cancer who have survived and are living up to today. So yeah, this is just a picture of the breast, and then you can see the reddish thing there. That's how the cancer starts. Next slide, please. Okay, so what are the risk factors of breast cancer? I'm sure we know that breast cancer is, like any other cancer in the body, an abnormal growth of cells in that part, and particularly this one is an abnormal growth of cells in the breast. Usually, it is there are modifiable and non-modifiable risk factors. So when I mean modifiable, things that you can do to change. And then we have the non-modifiable risk factors, things that you cannot do anything about. Example, you being a female. You can't do anything about that. So one very important risk factor for breast cancer is having a breast. So not only does breast cancer affect females, it affects males as well. I think about 1% of the total cases of breast cancer we see are males. So we do have men who get breast cancer, but it's more common in the women. So I would say rather having a breast is a risk factor for breast cancer. Increasing age, the mean age in Ghana is about 40 to 49 years. But however, we've had cases of people reporting or being diagnosed with breast cancer as early as, I think my youngest I've seen is 14 years old. So we have them coming in quite early. And then positive family history, so if you've had a relative, mother, sister, daughter, any first-degree relative that's been diagnosed with breast cancer, it increases your chances of getting breast cancer. So don't just play idle. You don't want to know about, you need to know about your family history. So previous history of breast cancer, if you've had cancer in one breast and then you've successfully got that treated, there's a possibility of it reoccurring in the other breast as well. So the early onset menstruation, late cessation of menstruation, having no children, starting a family at an older age, all has to do with the play of the hormone that causes, that predominantly comes to play in terms of causing breast cancer, and I'm talking about estrogen. So when you start your menstruation early, when you end your menstruation, like we call it menopause. So you have a long period of years that you're exposed to cycling of hormones, and the longer you are exposed to it, the higher the chances of getting breast cancer. So having no children, starting a family at an older age, just no breastfeeding, just basically in the case that the hormones still comes to play, because when you're pregnant, another hormone comes to play and then suppresses the effect of estrogen. So for the period when you're pregnant, the 9 months when you're pregnant, and when you breastfeed for 2 years, you're suppressing the effect of the estrogen. So at that point, your breast is not being exposed to the effects of that hormone. So that's how come all of this in the reverse is a risk factor for breast. I don't know if I've made any sense. I hope you understand what I'm trying to explain. Yes. So use of hormonal replacement, like I said, the same hormone, estrogen, contraceptive, people who are in their postmenopausal age, sometimes they give them hormone replacement therapy with estrogen, and that also increases their chances. So now we talk about the modifiable risk factors, so lack of exercise. Next slide. Lack of exercise, obesity, poor diet, all this, weight loss, alcohol, smoking, all this you can change, do something about it. Next slide, please. So what are the signs of breast cancer? Usually, typically in the early stages, which we want people to come out, there's usually no sign. It's just a painless lump sitting in the breast, not doing anything. So you have to actively go in search for it. If not, you will know that there's something there. So when you start seeing nipple discharge and change, particularly we are more interested in the bloody colored or in that range. So we have the red, very light, in between, from red, slight reddish to the extreme. Those are the nipple changes we're more interested in. The skin changes, so you know what an orange peel looks like. If you start seeing that changes and that kind of change in the skin, you should be suspicious of breast cancer. Changing the size of the breast. Everybody has one breast bigger than the other, but when you see a significant change between the two breasts, you should also, it's a possible sign of breast cancer. Lump or swelling in the armpit is also another sign of breast cancer. And then when it metastasizes, when the cancer moves from the breast to other parts of the body, like the chest wall, the lungs, the liver, you have other symptoms like coughing, back pain, can go to the bone, paralysis, etc. Next slide, please. Okay, so I've just run through the signs, symptoms, risk factors, statistics of breast cancer. And like I earlier said, usually in the early stages, it's a small lump sitting in the breast. So you have to actually actively go in search for it. And then the ways we can do this are by, I think, 3 steps. So we have the clinical exam, we have the imaging test, and then we have the biopsy. For the clinical exam, we have the self-breast examination, and then we have the clinical breast examination. That's the one that the clinicians, a doctor, a trained nurse, does for you. And then we have the imaging, and then we have the biopsy. So I would invite Sandra. She will run you through, she'll actually teach you how to do the self-breast examination. Ideally, once you're past the age of 20, it is recommended that you do it every month. The whole essence of that is for you to get to know what your breast looks like, so that the moment there's something wrong with it, you can easily pick it up. So it's advised that if you're still menstruating, 5 to 7 days after your period, you pick a date there, and then you do the self-breast exam. And if you stop menstruating, any day in a month, but it has to be the same day of every month, and then you do the breast self-exam. For the clinical examination, which is the one that a doctor or a trained nurse does for you, it is recommended that you should have one done every year if you're above 30. And that's because there are some lumps that your hands may not be finding, your hands may not be skilled enough to pick it up. There are some really small lumps that you may not see, but we may be able to see it. And then we move a step further to the imaging, and that's because there are even some smaller lumps that, no matter how much you palpate, the hands may not pick it up. So that's where the ultrasound scan comes in. If you're below 40, at least from the age of 20, you should have one done. And then when you get to 30, you should do one every 3 years. And then when you cross over to the age of 40, it's recommended that you have a mammogram done every year. And that's because, like I earlier said, the older you get, the higher your chances of getting breast cancer. These are the treatment modality. So we have the surgery, chemo. Depending on whatever type of cancer it is, there are different different treatment modalities for it. But I would like to say that it's not 100% certain that surgery involves removal of the breast. I think that's what most Ghanaian women are scared about. If it is picked up early enough and the lump is quite small, there's a possibility of saving the breast, which is why we're going out to educate people. When you come early, there's 100% chance, okay, there's a 95% chance from statistics that breast cancers in the early stages of stage 0 to stage 1, they have a 95% chance of, their 5-year survival rate is about 95 to 100%, which is quite good. So surgery does not always involve removing the breast. At this point, I would invite Sandra to take you through how to do the self-breast examination. Thank you for your attention.
Okay. We thank Dr. Odro for what she's taking us through so far. We also thank you for your time. We wouldn't waste much of your time. The self-breast examination, it's not anything much. And I will encourage all of us to be doing it every month. As she said earlier, 5 to 8 days after your menses is the right time to do the breast examination. Moreover, it doesn't take much time, so I don't know why any of us will give excuses why he or she doesn't do it. Because it's for men, it's for women. So you all have to do it. And to do it, as we said, 5 to 7 days after the menses, that's because during these days, the breast is not affected by any of the hormones. She made mention of hormones, which estrogen is one of them. And these hormones, they come to, they affect our menstrual cycle. So depending on the time, on the time of our menstrual cycle, each hormone will dominate. So during these 5 to 7 days, because we had just finished our menstruation, the body is now preparing itself for another cycle. So during these days, the hormones, they are all at their lower levels. So none is affecting your breast at these days. So when you do it, you get the normal breast to palpate. Unlike you doing it during your menses, when one hormone is dominating and you feel, I don't know if the ladies will attest to this, you feel some pain when you are about to menstruate or you are ovulating. Sometimes you feel it heavy. There are some pains. If someone hits it, you feel it. During this time, when you do it, the pain you are going to feel, how are you going to describe it? Is it breast cancer pain? Is it menstrual pain? So we want you to do it at this time. At this 5 to 7 days after the menses, the breast is okay for you to examine. And the examination is done by you. You take off your dress, your bra, then you stand in front of a mirror. When you stand in front of your mirror, you hold your waist. What are we checking? We are checking the breast, the size, the complexion, the nipple. So the complexion of the breast, you know your skin complexion, you know the complexion of the breast. So when you check and there's any discoloration, you should be able to detect. But how do we detect if you don't do it frequently? That's why we are encouraging all of us to be doing it every month. So we get to know our normal breast, to be able to pick the abnormal. Please, are we here? Yes. So when you check for the complexion, you check for the nipple. The nipple, we have nipple types. We have, some of us, we have pointing nipples. Others have flat ones. Others have inverted ones. At any point in time, when you see any changes in the nipple, you should be able to report to a health professional. So we should be checking that one also. Then the size, like my sister mentioned earlier, the size, ideally, one of the breasts is always bigger than the other. But the changes shouldn't be that visible. That when you stand in front of the mirror, one breast is so big, bigger than the other. If it happens that way, then there's something wrong, because the difference shouldn't be that clear. Please, after checking in the mirror, then you lie down. You look for a flat surface. It doesn't have to be a bed. Fine, a bed will make you comfortable, but if you don't have a bed around you, you can use a table. After it doesn't take much time. So you lie down on a flat surface. Then, if you want to check your left breast, your left hand will go under your head. We do that because that will help the breast more attached to the chest wall, so that the palpation will be easier. So when you lie with your left hand at the back of your head, then you use your right hand for the palpation. So the palpation, you are checking for any lump. The breast has its own lump. The breast lump is soft, is bigger. But this lump we are talking about, usually it feels like a granite or bean seed, very hard and small, and it's very, very slippery. So whilst you are lying down and you are checking, if you feel anything like this, it means that one is not normal. It's not normal to the breast lump. Tell me like something small about the risk factors. If the person can let me know the modifiable ones, the non-modifiable ones. At least 2 for each. Please, I'm waiting. My sister, you can go on. The modifiable, no. Yes, good. Okay.
And then the modifiable one is you not exercising and then kind of food you take.
Oh, good, good, good. Please, can we give her a clap? She's done well. Please, about the correct time for the self-examination. What time are we supposed to examine our breast? Is it any day?
No.
Please, what time exactly? Can you help us with it? Please. Okay. Okay. So what does that mean? Can someone... Yes, yes. But I want someone, if you can help us, like the 5 to 8 days.
I think you mentioned that within that period, there's no particular hormone active in the breast. Estrogen, sorry.
Yes. Okay.
Estrogen is not active within that period.
Okay. 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 Thank you. Please, she deserves a clap too. And please, the self-examination. What are some of the signs and symptoms you'll be looking out for during the self-examination?
For a peanut-like lump.
Okay. Okay, that's good. Please, anyone else? My sisters, I want to hear you. Oh, not that one alone, no.
And then if
Standing in front of...
like an orange peel.
Great, okay.
And if one
Great.
discoloration of the breast.
Good,
and
good.
if
Oh,
one breast is excessively bigger than the other.
okay. Very happy to hear this. So that means we've all learned something about breast cancer today. Okay, so we thank you very much for your time and also your contributions and everything. So please, from here, we are moving up there. There's a room reserved for us for the clinical examination. So we will go there, then we'll be calling you like one after the other. Then we do the screening for you. If you have any questions, you can as well ask us when we go up there. Thank you for your time again.
This is still Health Afrik on AAU TV, and AAU TV is still the voice of higher education in Africa. So after the discussion and everything we have learned from the session, we have to interview the management and participants who have participated in this program. So I have with me Mr. Dixon Seji. He is the marketing director here at Airport West. It's a privilege to have you here today.
Thank you.
Okay, so I was saying earlier that last year I came here to cover this great event, and I had to come here without a nose mask, and it was good. This time around, I have a nose mask. So I want to ask Mr. Seji, what inspired or what keeps inspiring Airport West to have this program to reach out to women and to help them in?
Yes, you are very right. Last year when we held this screening, the pandemic was not around, but this year, we are in the new normal. Life must go on. Our mothers are still special and important to us. So in the scare of this pandemic, we still wanted to provide the opportunity for women to be screened medically, because not all of them could afford going to the hospitals and other places for them to be examined. So if Airport West Hotel can do something like this, we are always ready to provide them with the platform.
All right, that's great. Well, I have one question for him because we all just learned something about breast cancer. So it's a yes or no question. Mr. Dixon, so do men get breast cancer? Yes or no?
Yes, they do.
Okay, second question. Do men have to undergo breast self-examination as well?
Yes, yes.
Hey, correct for 10 points. End of interview. Moving on to the next person. Please stay tuned. You're welcome.
Hi, thank you. I'm Sofa, and this is my first time here. And I can say I've pretty much been furnished with some new information about breast cancer awareness, especially the part where they tell you you have to feel a peanut-like button in your breast. And it's been awesome so far. So moving on to the screening. I understand Sonotech is giving us a 50% discount on screening. So we are moving to Osu now to have that done.
Hi, my name is Ella, and I was invited over here by my big sister. I must say I liked the experience. The organization was quite on point. And I mean, we learned a lot about the basics you need to know with regards to self-checks and all of that. Also, the screening was quite brief and, quite fast. And we also got a discount for our next, for the screening. And we just really appreciate. I think this is a nice initiative by Sonotech, and well done. And yeah, thank you. That's all.
So we are continuing. We are still speaking to participants, and I have with me my mother. Ma.
Yeah.
Pacho Udi.
Me didn't Margaret Ukwan.
Okay. Pacho then I will see our.
Oh, near my bishan say, oh, baby, I will boon, sir. After 5 days to 8 days, I was say, we check it on no phone no more. Hold on, sir. Ebeko utino wada. No, don't, son. On say, Yamuna atototo so. Ebeko round. No, dear Ben Finfina. A bit me crabby me and soon no wash. And soon any said, yeah, is if at ye. Until a mamma who near my baby.
That's the same. Now, quiet or screening now, nurse, ne share on. Send this if I call it.
Oh, no, so said your chair, say, was here, no. What damn panosoa. Would on son of a coach. No, then a son, Ninsa yem, and son, no. Afe faso. No, or ye in round. We will me no phone so she soon. No, we all say she in him. If he has a man, mumu, yenya opportunity say was the BI, buoyancy, yet try with Yana, my opportunity no soon so on Maya, will be unfunny when she no, because yarea.
That's a fine. Fibrocystic breast changes are composed of tissues that make breast feel tender, lumpy, or rope-like. This doesn't mean you have breast cancer. However, you can undergo a scan or imaging to be sure you are safe. Fibrocystic breast tissues are completely normal and doesn't increase your tendencies of breast cancer. This year, we are pinking it out and saving lives. That's all for Health Afrik. Do well to enjoy the rest of our programs.